Alright, so for the next microorganism that we'll be looking at is the what? Dipylidium Caninum. I hope I spelled it right. So I actually spelled it right. Dipylidium Caninum. Alright. And it is also known as a flea tapeworm. Alright. So it's a parasitic cestode that affect dogs, cats, and occasionally it affects humans. Alright. So it will affect humans when probably you take contaminated food or water, or maybe you take a cat meat or dog meat that was undercooked or was not properly processed. Okay, so we'll be looking at the morphology of this organism, look at the life cycle, look at the clinical signs, like if it is affecting dogs and cats, what will be the clinical signs? If it is affecting human beings, what will be the clinical signs? Look at the diagnosis, look at the treatment, and possible prevention measures that could be taken towards this organism. All right, so this is it here. All right, I get to see that the length of this organism is over what, 70 centimeters. All right, that's 28 inches. Its width is about what, 2 to 3 millimeters. That's about 0.08 to about 0.12 inches. Okay, and it has about, okay, the segments about 100 to 200 proglottides. Okay, life cycle. Eggs are released in the feces of infected hosts. Eggs will now be ingested by the flea larvae. All right. Now, okay, that means, like, let me say if it is in the human being now, you defecate. All right. Then the fleas can come feed on your feces and take up the larvae. Do you understand? So the larvae will now develop in the adult fleas. Now, the infected fleas can now be ingested by what? The host. That's either dogs or cats or human beings who take up some food or water that was contaminated by the fleas. Okay. Larvae will be released from the fleas, okay, body into what? The host body now. So larvae will now attach to the intestine and mature into adult tapeworm. All right. Later be passed out in feces, and that's how the cycle actually what continues. All right. So you can see this is what adult flea. Okay, sorry, from the feces. Okay, comes out, the flea start growing, becomes the adult fleas. The dog can still feed on it. It goes down again into feces, and the whole cycle actually what continues again. So if it is affecting dogs and cats, what will be the clinical signs? There'll be diarrhea, there'll be vomiting, there'll be weight loss, there'll be abdominal pain, there'll be intestinal obstruction. Right? If it is affecting humans, it's still the same thing: abdominal pain, diarrhea, weight loss, nausea, and vomiting. Okay, the diagnosis of this is you know that if even if it's in a human being, you actually will defecate it. So if it is something that you can defecate, one of the diagnoses is you can look for it in the feces. So fecal examination is trying to find out for eggs and segments, right? Imaging studies like CT scan, MRI, X-rays, serological test, okay, coprological tests or coprological examinations can also work. Treatments, these are the drugs to use for what? Infections from this disease condition, from this organism, right? Praziquantel, Niclosamide, and Epsipantel. Okay. Prevention is just do a fleas control, regular deworming of pets, okay, proper hygiene and sanitation, because most of these things they come from a lack of hygiene. They avoid coming in contact with contaminated water and foods. Epidemiology is, it has a global distribution. It more affects areas that have a poor hygiene and sanitation. Okay, estimate about what, 1 to 10% of prevalence in dogs and cats. Okay, so I think that's it for what? The Dipylidium Caninum.